Hi guys, thanks for joining me. I am Dr. Ayele Okine, and this is This Vet Wants You to Know. I am a veterinary internal medicine specialist, and today, after I tell you to follow me and subscribe and leave a comment, let me know how I'm doing, I do want to talk a little bit about a cancerous process called hemangiosarcoma. It is my least favorite cancer. Not that I like cancer, but it's probably one of the hardest things to talk to people about in the hospital when their pet comes in, because often their pets are really sick when they come in. And then on top of that, we often talk about this disease that progresses very rapidly despite really aggressive chemotherapy. Hemangiosarcoma is a cancer of the blood vessel cells, so basically the cells that line all of the blood vessels. When this cancer forms, it basically makes blood vessels that don't have the normal integrity of the rest of the blood vessels around the body. And so, what we see that happens with this is often these lesions, these masses will bleed, and there's less there to kind of stop the bleeding. And so we often see very, very severe bleeding, lots of clinical signs associated with that, and often they present in crisis. Most of the time, hemangiosarcoma, kind of the textbook classic case, is going to be a large kind of mass and blood clot on the spleen, or we can also see it on the heart. And so basically, in that situation, it bleeds into the sac around the heart. And because that sac doesn't have a whole lot of stretch to it, all of that bleeding compresses the heart muscle and doesn't allow it to contract and relax well. And so often these patients will come in with collapse. They're having trouble getting oxygen into their bloodstream. They have heart arrhythmias, or in some cases, they can die, spontaneously with this. In the spleen, same sort of thing as far as the bleeding's concerned, but there's a bit more of a capacity in the abdominal cavity to kind of hold that blood. And so often we'll see that they've bled for, a little bit of time before their symptoms come on. Or if they bleed and it doesn't stop in a timely fashion, sometimes we can see pretty acute changes. But often pet owners of pets that I diagnosed with a mass on the spleen, often these people say, there were a couple of days where their pet was a little off and then seemed to kind of sleep it off or get better as the day went on, and then was fine for a while, and then had another bad day, had a day that was weak, and then it got better. And what I think is happening in those situations is that the lesion on the spleen is bleeding. They feel terrible, get weak, or collapse. And then once the bleeding stops, the body is actually able to recapture some of that blood from the abdominal cavity. And then they feel better for a day until, or a couple of days until the bleeding happens again. When we see a mass on the spleen, especially in an older dog, we talk about the rule of 2/3. So 2/3 of masses on the spleen are going to be cancer, and 2/3 of those cancers are going to be hemangiosarcoma. So most of the cancers that we see on the spleen are going to be hemangiosarcomas. And again, most of the masses that we find on the spleen are going to be cancer. When they're not cancer, it's called a hematoma. So basically just a big bruise and a blood clot. And that can occur in an area where the spleen maybe wasn't super healthy and it was able to bleed. One other frustrating thing that a lot of my clients say is, okay, how are we going to know if it's a hematoma or this cancer? And unfortunately, the only way to really know is biopsy. Although in a lot of my other series, we talk about cytology, so just a cell sample that's put on a slide where a pathologist looks at that. Although cytology can diagnose a lot of cancers, especially the blood cell cancers, in this scenario, because of how much bleeding and blood clots and things there are, it's sometimes hard to get a representative sample that a pathologist can say, yes, I see that cancer cell. And often I need to see multiple cancer cells to really feel comfortable calling it cancer. And so a biopsy allows them to section the entire lesion, look at different levels, and actually see cancer cells and how they interact with the more normal tissue around it. And so in these situations, often the diagnosis happens after the life-saving treatment. And what that involves is actually taking that patient to surgery to remove the spleen. The spleen is not something that cats and dogs need. It's an accessory immune organ, meaning it helps to make blood cells. It helps to store and release red blood cells. So when you're running and you kind of feel that cramp on your left side, that's usually the spleen contracting to give you some extra red blood cells when you need it. And so what we see in these situations is we can take the spleen out and submit the whole thing for biopsy. And again, that's how we're going to know what we're dealing with, and that's also how we're going to save the life of the patient that's bleeding. There's no real other treatment that can be done, more conservative in that situation if you want to move forward and try to get, an answer and figure out, what you need to do next. I tell people it's never wrong to consider euthanasia, especially when the odds are stacked against a lot of these patients for it being cancer. But it really, you can't make a wrong choice. We either kind of go forward, we're all in, we're going to surgery, we're going to figure out what we're dealing with and then go from there. Or we're either considering euthanasia or maybe taking home. But I always tell people, this can bleed at any point and it can be life-threatening. And so if you make the decision to take your pet home, it's possible that they could pass away at any time. And so usually in that scenario, I say, if you're going to take home to spend some time, you need to plan on a euthanasia very, very soon, like with a matter of day or two, to try to beat that next bleeding episode. Once we have stabilized the patient, taken them to surgery, taken the spleen out to stop the bleeding, if they need blood transfusions during that time, we do all of that. We also, prior to surgery, want to make sure that there's no obvious evidence of this potential cancer being anywhere else in the body. And so that's going to, take x-rays of the chest, ultrasound of the belly to kind of take a look at everything and see what we can see. And then also at the time of surgery, the surgeons are going to be looking around. They're going to look at everything else in the belly and see if they find any evidence of anything else that looks suspicious. There are some situations where, x-rays and ultrasounds may not find evidence of spread or metastasis, and sometimes that's found at the time of surgery. But saying that, there's nothing that we can identify, we take the spleen out, we submit it off for sampling, and we get the patient stable. Once the biopsy comes back, it's either going to be benign or it's going to be cancer. And again, in the vast majority, we do find that it's this hemangiosarcoma. And in that situation, the prognosis, even if we do everything else beyond that point, the prognosis is still very poor. The median survival time with surgery alone, so if we only do surgery just to remove the spleen, the survival time is estimated to be somewhere between 1 and maybe 3 at the upper end months. I think a lot of oncologists are even quoting 1 to 2. And the reason that happens is this is such an aggressive cancer that already has access to the bloodstream. It's making blood vessels. It's taking attachments from other normal blood vessels to grow. And so often at the time of diagnosis, there's already micrometastasis. And that's usually what causes the decline or causes it to come back or causes, an owner to put their pet to sleep, because new lesions will form and those lesions will bleed. And so that's why the survival time is so short. If we do surgery to remove the spleen and we do aggressive chemotherapy on top of it, now we're looking at maybe 6 months. There are some reports in the literature that are a few months longer than that, but 6 months is kind of the average. And so it's a lot for an owner to say, hey, I'm going to do all of this and only get 6 months with their pet. And so a lot of owners in that scenario either choose at the time of diagnosis of the first mass to either euthanize or to spend time and then euthanize, because it's just a lot to go through to not really get much time at the end. Again, I'm not an oncologist, so the protocols that are used for treating these patients, chemotherapy wise, kind of out of my wheelhouse. And so I do recommend that if your pet, undergoes the surgery and the spleen comes back consistent with a cancerous process, again, namely hemangiosarcoma, I strongly recommend consulting with an oncologist to talk about what your options are. Pets tend to handle chemotherapy a lot better than people going through chemotherapy, but a lot of that reasoning is because quality of life for our patients is so important because we can't explain to them what's going on. And we use, or oncologists use, doses of chemotherapy that are a fraction of what a person would get. And so they often go through chemotherapy feeling a lot better, but in a lot of cases, we're not expecting a cure. Again, even if you don't elect to do any sort of chemotherapy, having the information is very valuable, and I strongly recommend it. It just helps you kind of make the most informed decision that you can. If you guys have any questions, feel free to leave comments. I'll try to get to them as soon as possible. Again, follow me, subscribe. That way I can continue to put out content and get you the information that you need to help take care of your pet.